One day after a half term I came back in, there's no Andrew. And I said, where's Andrew? And they said, he's gone to a school down south. So I said, why? And they said, well, family were struggling a bit and, you know, to cut a long story short, he's gone to residential school. So I said, right, why is that? And he said, well, he's got this thing called autism. So I said, what's that? Because I genuinely hadn't heard the term before. And they said, oh, it's where they can't kind of, you know, well, they have trouble with, well, it's kind of like they're locked in and they can't kind of socialise. I said, oh, right, okay. And that kind of started cogs in the back of my head going, and those cogs are still going. And what those cogs try and do is ask questions about autism and what it is and what it means for us and what it reveals to us. And I often think of Andrew, I often think about where Andrew might be now and whether he's happy.
I love that. Yeah, I love that.
We have a lot of work to do with families and carers, parents, for when their child reaches adulthood. They don't understand the law in terms of capacity and what rights the parents and carers may have and what rights they don't have. And I think that is a gap in the transition service from childhood to adulthood.
There are themes that were running throughout all of it really, which were sustained throughout all of the discussions that have we've been having. So definite things like themes such as there's no clarity for people. If you've got a child with autism or if you're an adult with autism, there's no clear pathway to get a diagnosis, or if you do, there's no or very little diagnostic support.
We talked about how children can learn from the behaviours of the siblings more than anything else. So where we talked around educating the children to change their behaviours, we started to think, well, maybe we should start perceiving the child with the condition in the way that the siblings do so.
So the focus of our group discussion was around the dehumanising understanding or lack of understanding of how we look at schools, how we practice in schools, and other practitioners might dehumanise in their professions. And so the discussion led to how practitioners are trained and how the deficit model seems to prevail, and the language of normalising practices around how we talk and work with children, young adults and adults with autism.
Okay, so we are looking at the barriers of moving from education into society. What are those barriers that exist? Do we need to negotiate around them? Do we need to try and move those barriers? And if so, how? What are our ways forward?
So our group met to discuss about the challenges we face within professionals and in the community about normalizing and making interventions and support for children and adults with autism easy and acceptable. And we felt that the issues, the challenges are because these are seen as too specialist and for only specialists to deliver. And so the outcome of the discussion was that we should make the interventions and the support a norm rather than something too specialist for it to be widely accepted.
The diagnosis and how it's important not to group all people with ASD together, obviously because the spectrum's so broad. So obviously from one end of the spectrum to the other when you're high functioning, and that was my main questions, and really for parents to feel like they have a choice.
So that's all we're doing, is just helping people have great conversations, talking about what matters to them, so that we can bring about change.
Well, the field of autism is full of intriguing questions, and it's populated by very curious people, and I suppose one of the great benefits of today is to give us the space for those very curious people to ask those intriguing questions.
How do we, as parents, learn from other children's perceptions of autism?
Do parents and carers understand the law when a child reaches the age of 18 and has capacity or doesn't have the capacity to make a decision?
Our main outcomes were education and information to change societal perspectives of autism for children and young people.
In looking at pre and during and post-diagnosis of any neurological condition, the most important thing is that there is consistency in service across the country.
Reflections on the dehumanising system of schools, which is then reflected in training of teachers and other practitioners through a deficit model.
In moving from education to society, we need to question what are the barriers that exist. Do we need to move them or negotiate them? And if so, how do we do it?
Evidence in the use of education healthcare plans as a tool to navigate systems for families, children and professionals in a holistic, collaborative, proactive rather than reactive way.
We felt that the interventions or training has to be normalised for it to be widely accepted and to become a norm.
If you've got a diagnosis of autism or you're waiting to be assessed, that you don't necessarily get the right mental health support or referrals.
In context of diagnosis, important to not group all people with ASD together and make presumptions. We need to share information.
There is a serious lack of support for adults with autism in services of community and in employment. Invisibility is a major issue. What research can we do to make a difference?
Nationally, there needs to be a more dynamic drive towards autism awareness and support for people with autism, their families and for us professionals.
Sensory-based behaviours can be a release, but often misconstrued as bad behaviour.
Have education, health and care plans improve the lives of children and young people with autism and their families?
Realist evaluation can tell us what parents and young people really value.